Hello, this is Dr. Gay from First Lake MRI, and this is a 17-year-old female who has knee pain. She's had a prior ACL reconstruction. To get oriented here, this is the kneecap, this is the patellar tendon in the front, this is the back, these are the gastrocnemius muscles. And we see this band coming obliquely down from the back of the femur here to the tibia, and this is the ACL graft. It is intact. It's a little bit thickened here, but this is within normal limits for an ACL graft. It's not torn, maybe minimal degenerative signal. So an intact ACL graft, but we do see something that's abnormal in front of the graft. There's a sharply defined area of low signal here, a band of fibrosis, and then deep to that we have this area of irregular mixed low signal with hyperintense bright signal around the rim, and this is what we term arthrofibrosis. It's right at the midline in front of an ACL graft. And it's just a mixed collection of granulation tissue, synovium, fibrous tissue, all mixed in, and this can cause pain in the knee and difficulty extending the knee because this process is here in front, and they need to go in there arthroscopically and remove this mound of granulation tissue and fibrous tissue and scarring. And once they remove it, the patients usually do very well. And they call it a Cyclops lesion because supposedly it looks like an eye. When they do arthroscopic surgery with the scope, they see different colors of red and blue from venous channels, and supposedly it looks like an eye. And even radiographically, sometimes it'll be more rounded than this, and it will look like almost like an eye here in the middle. So a Cyclops lesion, which is related to usually patients who have had ACL repair, and they have a inflammatory response here that's not very well understood, and the front usually related to the altered mechanics from that surgery. Some people think it may be pieces of that ACL that's been torn, maybe a fragment of that is hanging out in front and having your inflammatory response, or maybe there's some abnormal mechanics, it's pinching some material here in front causing that. But again, it's not well understood. But when you see a midline tumefactive area here like this with mottled areas of low signal surrounded by bright signal, and then sometimes a sharp band of fibrosis around the rim, this is arthrofibrosis from related to the ACL graft, and they'll need that thing resected. Thank you very much.